Hi, welcome to the next video in the video lecture series from Destiny Empowerment Group. Please keep in mind that the information provided in the video is not a substitute for medical advice from your physician. If you tuned in last week, you heard Destiny talking about the squat, a very common exercise. She also mentioned sometimes that people may not want to squat because they have pain in the front of their knee or anterior knee pain. Sometimes this could be patella tendinitis, commonly known as jumper's knee. Today we're going to talk about the causes of patella tendinitis, the location and the signs and symptoms, and some easy things you can do at home to treat patella tendinitis. Patella tendinitis is an overuse injury. It usually occurs after some sort of eccentric overload. Think running downhill or landing after you jump. This eccentric contraction or lengthening of the muscle puts stress on that patella tendon. The patella tendon is the area located between the inferior or the bottom of the patella and the tibia or the bone in the lower leg. This quadriceps tendon or patella tendon is commonly referred to also as the patella ligament. This is the connection point of our quadriceps to our lower leg. There are several things you can do when you find out that you have patella tendinitis. Usually patella tendinitis will show up in the form of anterior knee pain, pain after whatever aggravating activity you've done, pain after sitting or kneeling for long periods of time, or sometimes pain when you try to stretch your quad or hyperflex your knee. The first thing I would encourage you to do is maybe take a break or a short rest from whatever aggravating activity it is until you can decrease the inflammation. In order to decrease the inflammation, with permission from your physician, you can take some anti-inflammatories. The patella tendon becomes inflamed during patella tendinitis, and the anti-inflammatories will help decrease that inflammation. Ice is also a great tool to use when you have any sort of inflammation. 2 to 3 times a day, for about 15 or 20 minutes, you can apply an ice pack. I would discourage the use of the chemical ice packs. They have been known to cause burns. But you can use a bag of frozen peas out of the freezer. They work just as well. Make sure you mark the bag so you don't try to cook the peas in the next week or so. I would also encourage you to do some stretching. I want to show you several stretches you can do for both your quadriceps and your hamstrings. First quad stretch you would do is lie face down on the table, put a towel under the leg right above the knee, and wrap either a band or a rope around the foot. Pull the foot towards the buttock. An alternative stretch you can do for the quadriceps is to put the involved leg, lace side of the foot down on a table, with your knee pointing straight down, slightly lean back. You should feel the stretch on the anterior or the front side of the thigh. For a hamstring stretch, put the involved leg on a step, keeping the back and the leg straight, bend forward. Make sure you lead with the chest and don't round your back. An alternative hamstring stretch is to sit on the table with the involved leg and the buttock on the table, and again, keeping the back straight, lean forward with the chest. The uninvolved leg should be on the ground beside the table. Now that you've decreased your pain, hopefully reduced your inflammation, and been very diligent about your stretching, you may be ready to return to activity. A couple things I would encourage you to do as you get ready to return. Focus on the eccentric portion of any lift that you do. This will be the lowering of the exercise. You do a leg extension, you concentrically contract your quadriceps to extend your knee, and then you would want to slowly lower to have that eccentric contraction of your quad. Same thing with your squat. Make sure you have a slow and controlled lowering and rising from the squat position. You may want to have an infrapatellar strap, sometimes known as a Chopak strap. These can either be prescribed by your physician, or you can pick them up at your local pharmacy or sporting goods stores that sell any sort of protective equipment. Now that you know some basic, easy steps to take care of your patella tendinitis, I hope you're ready to get back to activity. Good luck with your exercises, good luck with your workout, and we'll see you next time. Take care.